Hello, great to have you with us. Thank you for joining me on this webinar today, and I'd like to start by just thanking Purina for the opportunity to present to you today. And we're going to be looking at crystal-related disease in lower urinary tract in cats. Now, when it comes to lower urinary tract disease in cats, we are all familiar with the typical clinical signs that we see: dysuria, hematuria, polachuria, increased frequency, and sometimes stranguria, particularly in male cats. But of course, we recognize these as signs of lower urinary tract disease, but it doesn't indicate the site or the underlying cause of the disease. So a logical approach to investigation of these cases is always going to be necessary. In terms of prevalence of lower urinary tract disease as an entity, as a syndrome, if you like, in primary care practice, there are a number of studies that have been published in the literature that have looked at this. They provide varying estimates of the prevalence of lower urinary tract disease as a primary presenting sign in first opinion practice. But generally speaking, we would recognize perhaps around about 4 to 5% of cats presenting to us to be affected with lower urinary tract disease. This was one study published a little while ago from the United States in JAVMA, and in this particular study, where they looked at health characteristics of a large population of dogs and cats examined at private practices, lower urinary tract disease, feline urological syndrome, or cystitis, as they called it, accounted for around 3% of cases that presented. That's the feline population. More recent study from the UK has looked at a large number of primary care practices in the UK and the most common presenting complaints in those practices. You can see from the slide here, dental disease was the single most common, not too surprising, but lower urinary tract disease accounted for almost 4.5% of the cases. So we recognize lower urinary tract disease commonly in cats in first opinion practice. Now, we've said that this is a syndrome, if you like. Clinical signs don't tell us what the underlying cause of the problem is. But if we look at those studies that have identified cats predominantly in primary care practice with signs of lower urinary tract disease and have then worked them up to identify the underlying causes, these are the typical sort of proportions that we see. Idiopathic cystitis remains the single most common diagnosis that is made in these cats, and that accounts for around about 60% of cases on average. But then we have crystal-related disease, either urethral plugs, which are typically seen in around 15 to 20% of cats, or urolithiasis, again seen in around 15 to 20% of cats. And those are the two diseases that we want to focus in mostly today. In terms of risk factors for lower urinary tract disease, clearly it's going to depend on the underlying etiology. There will be differences depending on the underlying cause of the disease, but generally we see lower urinary tract disease cases presenting most commonly in middle-aged cats, perhaps 2 to 6 years of age. Obstructive disease, urethral obstruction, occurs almost exclusively in male cats because of the longer, narrower urethra that they have. And we see an increased risk, generally speaking, in neutered cats, in cats that are fed dry cat food and perhaps have an increased frequency of feeding, cats that lead a sedentary lifestyle, cats that are pretty lazy, if you like, that are obese and that are kept indoors, and cats that have a lower water consumption. And there are probably interrelated factors going on in those cats. This is a cat I saw a number of years ago now, a cat called Ben, but he presented with lower urinary tract disease, and indeed he is a typical cat with major risk factors for this. He was a 5-year-old neutered male cat. He was obese. He weighed 13.5 kilos, as you can see. Body condition score was 8 or 9 out of 9. He was an indoor-only cat. He was fed dry food, and he led a very sedentary lifestyle. So we've got lots of risk factors. Not surprising that he presented with lower urinary tract disease. But there are some factors that distinguish the different types of lower urinary tract disease. This is a study from Germany where they looked at a group of cats that presented with lower urinary tract disease, and these are the average ages in the different underlying causes of lower urinary tract disease. And you can see that things like urinary tract infections and lower urinary tract neoplasia, generally speaking, occur in older cats, whereas things like idiopathic cystitis, urethral plugs, and urolithiasis, they tend to occur in younger cats, on average around 5 to 6 years of age. But again, that age range doesn't distinguish between those different underlying causes. So what should we look for? Well, as we've said, the majority of cats are likely to have idiopathic cystitis. That affects more than 60% of cats with lower urinary tract disease. But before we make a diagnosis, if you like, or presume it's idiopathic cystitis, we should think about those other causes. Looking for urolithiasis, looking for underlying urinary tract infection or neoplasia perhaps in an older cat. Some cats may have anatomical defects. There may be urethral strictures, for example, or occasionally we may have a cat that actually has a behavioral underlying cause for the clinical signs. So we need to consider carefully the history and physical examination, what that can tell us, urinalysis and culture of the urine, and diagnostic imaging. Now, when it comes to history and examination, there are a number of features that can be helpful to us. Is this the first episode of disease, or is it recurrent disease? Certainly if it's recurrent disease, we probably want to think about a better diagnostic workup for that cat. What is the dietary history? What has the cat been fed on? How long are the episodes of lower urinary tract disease lasting? Are they associated with pain and discomfort? Is there any evidence of urethral blockage, stranguria? If the cat's urinating outside of the litter tray, where is that occurring? Is there any evidence that there could be behavioral underlying disease? Is there evidence of stressors in the environment that could indicate behavioral disease or might be associated with idiopathic cystitis? How much urine does the cat pass when it urinates? Does the cat have an empty bladder? Is it straining on an empty bladder, or is it straining on a full bladder? These are all things that are quite useful for us in helping to narrow down what could be going on. Obtaining a urine sample obviously is a fundamental step in the diagnostic workup of these cases. We would normally go for a cystocentesis urine sample if we can. That is often easier for us to obtain, and obviously that should be a sterile urine sample. When we've got a urine sample, we want to look at the urine-specific gravity, see how concentrated it is. We want to probably do dipstick biochemistry. Certainly we want to look at the pH of the urine, because that can be associated with certain risk factors when it comes to urolithiasis. We want to look at the sediment of the urine. Whether that's done in-house or at an external laboratory, that urine sample needs to be spun down. We need to look at the sediment, see if there is crystals there, see if there is evidence of bacteria or inflammation, etc. And particularly in recurrent disease, or if we see evidence of bacteriuria, then we'll be wanting to do a culture and sensitivity as well. Now, frequently, when we look at a urine sample, we do find crystalluria. Typically, that would be struvite or calcium oxalate. Those would be the two most common forms of crystalluria that we see, but we need to be careful about how we interpret this. The presence of crystalluria definitely indicates that the urine is supersaturated for those particular crystalloids, whether it's struvite, whether it's calcium oxalate, or some other crystal. So the urine is supersaturated, but we know that, of course, cats do tend to produce very concentrated urine. And the question is this pathogenic or is this non-pathogenic crystalluria? Crystalluria can occur as an in vitro event, so we may have crystals forming in that urine after we've collected the urine sample, perhaps as it begins to cool down, as there's some evaporation of water perhaps, or perhaps there's alteration in pH. So the crystals can form after we've collected the urine, particularly if we send it to an external laboratory. Even if we look at a fresh, warm urine sample and we see evidence of crystalluria, that doesn't mean there's any disease process going on. It may be non-pathological, it may be completely asymptomatic. But it would be a risk factor for development, perhaps, of uroliths or urethral plugs, and in some cases may indicate underlying metabolic abnormalities, things like cystine uroliths or crystals, urate, etc. So just to emphasize how common crystalluria is in cats, this is a study that was published from New Zealand looking at the prevalence of struvite crystalluria in apparently healthy cats fed a range of different commercial diets. Most of these, as you can see, were dry diets. There was one wet diet. But you can see that there is a range of different pHs of the urine and a range of different prevalences of crystalluria. Anything from none of the cats having crystalluria in the cats fed a wet diet that had a relatively acidic urine, through to over 70% of cats fed one of the dry diets that had a more alkaline, or trending towards a more alkaline pH. Again, these were all completely healthy cats. This was another study that was conducted in the UK looking at a group of cats that were fed a mixed wet and dry food, looking at the prevalence of crystalluria in fresh urine samples that were left for a few hours on the bench, urine samples that were put in the fridge, or urine samples that were sent to a laboratory and arrived 1 to 2 days later. And you can see that as those urine samples were left under different environmental conditions, the prevalence of crystalluria increased markedly. So in fresh samples, 24% had crystalluria. In samples that were received by post at the external laboratory, 75% of them had crystalluria, most of those being in vitro crystallization after the urine was collected. So it's just important to remember that crystalluria itself is a normal finding and can be normal in up to 75% or more of cats, depending on how the urine sample was collected and how soon it was analyzed. Third part of diagnostic workup of these cases will usually involve diagnostic imaging. Radiography is very valuable with lower urinary tract disease, probably more valuable than ultrasonography in most cases. We typically would use plain and contrast radiography, and we can see the things like the presence of uroliths. We can see the bladder wall and see if there is thickening and whether that is irregular and focal thickening. We can do retrograde urethrograms to see if there is any evidence of urethral strictures. So we get a lot of information from plain and contrast radiography, and we can get some complementary information from ultrasonography as well. So we want to focus in now on crystal-related lower urinary tract disease, and that is either urolithiasis, and the two most common uroliths that we see are struvite or calcium oxalate. And also I want to mention just a little bit about urethral plugs as well. Urethral plugs are probably the most common cause of urethral obstruction, and they have a complex pathogenesis, but there is a matrix plug that is present in urethral plugs. That is a matrix that's predominantly made up of proteinaceous material, albumin and inflammatory proteins that have leaked into the urine. And we think that in most cases, the underlying cause here is probably idiopathic cystitis. So we have some inflammation going on in the lower urinary tract, and that's forming this mucinous plug, if you like. But that on its own probably would be past. It's the fact that crystals and cellular debris get trapped within that proteinaceous plug that really causes the urethral obstruction. In most cases, that plug is composed of proteinaceous material with struvite crystals. Occasionally, calcium oxalate crystals can be present. So when it comes to interpreting crystalluria, most cases are going to be completely healthy cats. Crystalluria present as an incidental finding, simply because cats produce concentrated urine. But the crystals that are present in the urine can contribute to urethral plugs, and so can be a contributory factor to urethral obstruction in cats with urethral plugs, or the crystal urea can be a risk factor for development of urolithiasis because it indicates supersaturated urine. Again, with those urethral plugs, it's been suggested this is like a fruit jelly. The jelly being the protein matrix, the inflammatory proteins that are present, and the little bits of fruit like the cellular debris and the crystals that get trapped in that inflammatory matrix. And the two of those together can form a plug which is very difficult to pass through the urethra. Crystals on their own, inflammatory proteins on their own can probably be passed without any real problem, but the two together can form a plug that causes urethral obstruction. So the underlying cause might be idiopathic inflammation, idiopathic cystitis, but the crystals are contributing to this, and that's one of the reasons why in cases of urethral obstruction, with urethral plugs, for example, we would recommend a lower urinary tract diet, a therapeutic lower urinary tract diet, to try and eliminate crystals that are present in the urine, reduce the risk of recurrent urethral obstruction. I want to spend a little bit more time talking about urolithiasis, though. And we need to remember that the development of uroliths, of stones in the lower urinary tract, is really quite a complex phenomenon. There are several mechanisms that are needed to be in place, if you like, for a urolith to grow. We have to have initial crystal formation, crystal nucleation, as it's called. And those crystals then have to grow. The crystals themselves have to get larger, they have to be retained, they need to aggregate together to begin to form a small stone, the beginnings of a small stone. All of that has to be retained in the bladder, and there has to be growth over time before we get a genuine urolith developing. Now, the composition of the urine is absolutely critical. It has to be supersaturated for those crystals to form, for those crystals to grow. But there are a number of other aspects of the urine that may be important as well. Urine pH, we know, can be important, particularly for struvite crystal development and for struvite urolith development. But there are promoters and inhibitors of urolith development in the bladder and in the urine as well. Those too have an important role to play. Let's just switch briefly to a case history to help us with this journey. This is a cat called Chaz. He was an 11-year-old, male-neutered domestic long-hair cat. He had a long-standing history of diabetes mellitus that was well controlled with protamine zinc insulin. But he had a 6 to 8 month history of recurrent signs of lower urinary tract disease. He had one episode of obstruction during that time, which had been relieved by catheterization, and he had been put onto a struvite type diet, combination of tin diet and dry diet. But he still had recurrent episodes of lower urinary tract disease, so he was referred in to us for further investigation. On clinical examination, he was an overweight cat, one of the risk factors for urolithiasis, obviously. Urine sample that we collected was sterile. We submitted it for culture and sensitivity, but it was sterile. The pH was 6, so we're in the mildly acidic range of urine pH. But there were some oxalate crystals present in the urine. So we know from the start his urine was supersaturated for calcium oxalate. Now, one of the risk factors for calcium oxalate crystals and stone formation is systemic hypercalcemia. So we checked hematology and serum biochemistry. All of that was unremarkable, and his serum calcium levels and ionized calcium levels were normal. When we undertook our diagnostic imaging, you can see here on the plain radiograph, we've got a small number of uroliths, radiodense uroliths in the bladder itself, and one that's present there in the neck of the bladder as well. So we can see these on plain radiography. They are radiodense. We also did a pneumocystogram with him and a double contrast cystogram. That helps us to look to see if there are any other abnormalities of the bladder. And I think you can appreciate on those radiographs, there does appear to be a generalized thickening of the bladder wall, probably related just to long-standing irritation and inflammation of the bladder. Now, what we would typically do in these cases, particularly with long-standing disease, is also just to check the urethra. So we did a retrograde urethrogram, as you can see here, and we've got a couple of areas on that urethrogram where the column of contrast media is narrowing down. And so an immediate thought is, well, could we have urethral stricture as well as these uroliths? That would certainly be a possibility. Now, whenever we do this, we really need to repeat the urethrogram to make sure that those apparent filling defects are persistent. When we did a second urethrogram with him, it was in fact completely normal. So those were areas either of poor filling on the first attempt, or perhaps where there was some urethral spasm, temporarily causing a narrowing in that column of contrast. In the end, no urethral stricture. So, with calcium oxalate stones, we know we can't dissolve those medically, so we went ahead and did a cystotomy with him. We removed the calculi and we submitted them for quantitative analysis to confirm the nature of them, and they were 100% calcium oxalate uroliths. And so then, in terms of longer-term management, we need to think about potential underlying causes and what approaches we can take to minimize the risk of recurrence, because we know there's always a significant risk of recurrence in a cat that's already had one episode of urolithiasis. Now, historically, we know from many studies that have been published that back in the 80s, struvite urolithiasis was by far the most common type of urolith that was seen in cats. Over time, calcium oxalate urolithiasis became more prevalent. And for a while, during the 1990s, calcium oxalate uroliths became more common than struvite uroliths. Current data suggests that these occur with roughly equal frequency, at least in most studies that have been done. But it's important to remember that these studies are all from uroliths that have been removed from cats and submitted to a laboratory for analysis. It doesn't really give us a true picture of the overall prevalence of these, because particularly with struvite, a number of stones will never ever be removed surgically because they will be dissolved medically. Important to recognize that we also see geographic variations in the prevalence and relative prevalence of struvite and calcium oxalate uroliths. These are all studies that were done over a similar period of time. You can see Germany, Canada, USA, UK, Spain, and New Zealand, but they show some quite different relative prevalences of struvite and calcium oxalate uroliths. So there do appear to be geographic variations in this as well. So when we see urolithiasis, stones that develop within the urinary tract, we know that there are many sites that can be affected. In humans, nephroliths, stones in the kidney, are the most common type of urolith encountered. We certainly see nephroliths and ureteroliths much more commonly in cats than we used to, in part because calcium oxalate stones are more likely to affect those areas. Otherwise, we see stones in the bladder, urocystoliths, and they still represent the most common type of urolith that we see in dogs and cats. And we can see urethroliths as well, uroliths that have become lodged in the urethra and cause urethral obstruction. And we've talked a bit about the development of these uroliths, lithogenesis, development of uroliths, depending on initial crystallization, nucleation, as it's called, crystal nucleation, growth of those crystals, aggregation of the crystals and retention of the crystals in the bladder all being important. Supersaturation of urine being a critical fundamental point, but also promoters and inhibitors. When it comes to supersaturation of the urine, if the urine is in a high level of supersaturation for a particular crystalloid, what we would call unstable supersaturation, that allows spontaneous crystallization to occur. It allows growth of those crystals and growth of uroliths. Below that, there is a range of what's called metastable supersaturation, where spontaneous crystallization won't occur, but if there are existing crystals or uroliths in the urine, there's still a possibility that they can continue to grow. And below that, there is a level of undersaturation, where the urine is no longer supersaturated for the crystalloids, and where there is undersaturation, it's impossible for crystals to form, impossible for crystals to grow, and they may actually dissolve. So we can see resolution of uroliths through dissolving of them with undersaturated urine. Risk factors for development of urolithiasis are complex, and many of these we don't have a really good handle on at this point in time. Certainly, urine supersaturation is going to be a critical factor. That goes without saying. There are also important things like the frequency of urination and how well the cat will empty the bladder on each occasion. This relates to the ability of crystals to be retained and continue to grow within the lower urinary tract. So there are important physical things going on here that may tie in with lifestyle. A cat that has a sedentary lifestyle, a cat that is obese, may urinate less frequently. So there may be longer retention of crystals in the urine, allowing for better crystal growth. Diet is going to be important, but we also recognize genetic and sex-related risk factors for development of urolithiasis. Underlying urinary tract infection with struvite uroliths, that's uncommon in cats, but it can occur. We know that that is very common in dogs. Underlying abnormalities of metabolism can be related to risk for development of urolithiasis. And we've already said this idea of there being promoters and inhibitors in the urine. This was the radiograph from Chaz showing his calcium oxalate uroliths there. But just briefly, there are a number of inhibitors of crystallization and urolith development that really are important. Otherwise, we would see urolith development far more frequently in cats because they're often producing very concentrated urine. And inhibitors of urolithiasis can act at a number of different levels. There may be substances in the urine that inhibit that initial nucleation, the initial crystallization, calcium and oxalate molecules coming together to form a crystal. There can be factors in the urine that increase the solubility of those individual salts, the calcium and the oxalate. There can be inhibitors in the urine that help prevent growth of any crystals that have already formed. There can be inhibitors that prevent crystals aggregating. So once crystals have formed, stops them aggregating together to become a macroscopic stone. And there are other inhibitors that can prevent adherence of those crystals to the bladder wall. So we have a wide variety of different molecules in urine, many of which we're not really too sure about at this point with cats, but a wide variety of molecules that may be important in inhibiting stone development. We do recognize some different risk factors with struvite and calcium oxalate uroliths in cats. Some risk factors are the same. Being an indoor cat, being an obese cat, being a lethargic cat, those are the same for both struvite and oxalate. If we have a very highly acidic urine, that is a potential risk factor for development of oxalates. So we don't want to produce strongly acidic urine. There are certain breeds that are predisposed to these stones, and the breed predisposition is somewhat different between struvite and oxalate, again suggesting perhaps some underlying genetic causes there. Generally speaking, although neutered cats are predisposed to uroliths in general, struvite is a little bit more common in female cats, oxalate a little bit more common in male cats. Struvite tends to be in slightly younger cats than oxalate, but these are not things that help us to clinically distinguish the two types of uroliths when we see a cat with urolithiasis. We know too, of course, that hypercalcemia and hypercalciuria is a risk factor for development of oxalate uroliths. So what about guidelines for management of these uroliths when they occur? The ACVIM have developed and published guidelines, consensus guidelines on the treatment and prevention of urolithiasis in both dogs and cats. And they recommend that where struvite uroliths are suspected, unless there is any contraindication, we should use dietary measures to try and dissolve them. Certainly if there are bacteria present, if there's a UTI, that should be treated as well. But if we think struvite could be involved, try a diet as a first measure to see if we can dissolve them. If we can't dissolve those stones with diet, if we think that calcium oxalate may be involved, then if they are symptomatic, we should remove them. If they are asymptomatic, then there may be some rationale in saying, well, let's just wait and see. Maybe continue with a dissolving diet and just wait and see. Now, I just want to share one study with you. This was a study that was published a little while ago looking at a particular therapeutic diet, in this case Purina Proplan veterinary diet, UR diet, to dissolve uroliths in cats. This was a study that was conducted at the Colorado State University in the USA. They were looking for cats with signs of lower urinary tract disease, and where they found radiographic evidence of urocystoliths, these cats were recruited to the study. So they were looking for urocystoliths that were radiodense, and they excluded cats with a really marked acidic urine, so if the urine pH was less than 6. These cats were actually housed at the university for the duration of this study so that they could monitor them very closely and control their food intake. They were fed the Proplan UR therapeutic veterinary diet exclusively, and they were fed the dry form of the diet, and they were given antibiotics if a urinary tract infection was identified. These cats were monitored closely on a weekly basis. They were given analgesics if necessary, and the plan was if there was no change in the urolith after 4 weeks, if radiographically there was no reduction in the size of the urolith, then they would take them to surgery and remove them and analyze them. And this is the study as it panned out. So 12 cats were recruited. For 5 of those cats, they ended up being diet responsive. The uroliths that were present completely dissolved, and in fact, radiographic resolution occurred after 1 week in one of the cats and after 2 weeks in the remaining 4 cats. Those were assumed to be struvite uroliths, and they completely dissolved. The cats were asymptomatic at the end of it. In the other 7 cats, those were classified as non-responsive. 1 cat actually with quite severe disease was taken to surgery after 2 weeks. 5 cats were taken to surgery after 4 weeks, and 1 cat after 6 weeks. And when the stones were removed from those cats and when those stones were analyzed, 5 out of 7 had calcium oxalate uroliths, and in 2 out of 7 they had mixed uroliths, including calcium-containing uroliths. So interestingly, with this study, none of the 5 cats that had calcium oxalate uroliths in the bladder None of those had calcium oxalate crystals in their urine. So crystalluria is a poor indicator sometimes of the presence of urolithiasis and the type of urolith present. Overall, 3 of the cats had bacterial UTI during the course of the investigations, which were treated successfully. 6 cats were available for follow-up, 3 from each group of responders. They were followed up for a period of 1 to 6 months. None of them had any recurrence of disease. And that's important because we know with both of these types of uroliths, we can have recurrent disease fairly frequently in cats that are not maintained on a therapeutic diet. So this diet was shown to be effective for dissolution of struvite uroliths. The 5 cats with presumed struvite uroliths, their uroliths completely dissolved. The other cats with calcium oxalate, we know that we cannot dissolve them. They can't be dissolved medically. We can't undersaturate the urine for calcium oxalate, so always we need to go to surgery. But a diet can be valuable still in maintaining those cats long term. So going back to Chaz, we removed those calcium oxalate stones from him. We know there was no identifiable risk factor. There was no hypercalcemia present with Chaz, so no specific underlying disease that we could correct, as it were. And so we then had to look at dietary modification to try and help prevent recurrence. So we minimized the risk of recurrence by using a therapeutic diet that produces a low relative supersaturation for calcium oxalate. So a diet like Proplan UR is an ideal diet for this, and with Chaz we chose to switch him to a canned diet only, a wet diet, because that may help to produce a more dilute urine. So with crystal-related disease, long-term, we want diets that are going to minimize risk of recurrence, have a low relative supersaturation for calcium oxalate, and an undersaturation, very low relative supersaturation for struvite. And that can be achieved with therapeutic diets. Good therapeutic diets we know are highly valuable. Also, because we can produce a low saturation, undersaturation for struvite, these diets are ideal for dissolving struvite uroliths. So for maintenance and also long dissolution of struvite uroliths, these are excellent diets. They are producing moderately acidic urine, so we're not increasing the risk of calcium oxalate, but we're helping to dissolve struvite uroliths. And as we've said, generally we would go for a wet diet if possible, or with a dry diet we can increase the salt content a little bit to help increase water intake. Now, if you want to read more about this and learn more about management, and particularly dietary management of urolithiasis, I'd encourage you just to scan the QR code that's on your screens, and that will take you to the Purina Institute website, where you can sign up for communications from Purina Institute. They issue scientific communications about nutrition, not about products, but about nutrition. And you'll be able to download this new ebook completely free of charge, Clinical Nutrition of the Dog and Cat. And it's a great ebook. I'm not saying that just because I authored a couple of the chapters, but really genuinely very useful, very practical information. So scan the QR code, you can get more information. I did also just want to mention briefly the importance of water when it comes to urolithiasis and long-term management. We know from human medicine that increasing water intake is one of the most useful things that can be done to manage urolithiasis on a long-term basis. Management guidelines for urolithiasis in dogs and cats also suggest that water intake is very important. Those consensus guidelines published by the American College of Veterinary Internal Medicine suggest that, particularly with calcium oxalate, where we can't dissolve uroliths, on a long-term basis to minimize the risk of recurrence, we should be aiming for a urine-specific gravity, if possible, less than 1030. So quite a dilute urine. That helps to increase frequency of urination, probably encourages emptying of the bladder on a more frequent basis, and also will help to reduce the saturation of calcium oxalate in the urine. Now, as we've said, with a dry food, if we have a cat that has a preference for a dry food, if we moderately increase the salt content of that diet, that will result in greater water being consumed and a lower urine-specific gravity. So it is a strategy to help produce a more dilute urine for cats that prefer a dry diet. So a therapeutic diet like Purina, Proplan, UR has a moderately increased salt content just to help produce a more dilute urine. And you can see from the different studies that have been done with this, that moderate increase in salt does result generally in a lower urine-specific gravity, a more dilute urine. So this can be valuable in cats that prefer dry food to wet food, and we know that some cats do have a strong preference. However, the urine doesn't achieve the optimum dilution simply by moderately increasing the salt content. Having a wet diet rather than a dry diet does generally produce a lower urine-specific gravity. This is a study that was published a few years ago looking at a diet, identical diets, but just varying the amount of water in the diet. And once we get up to around 70-80% moisture in the diet, then we begin to induce some diuresis, as was shown in this study. Total water intake was normal in up to 50-55% water in the diet, identical across a whole range of different moisture contents, between 6% and over 50%. But once we get up to 70-80%, we begin to induce some diuresis. That increased water intake with a high water content in the diet results in a lower urine-specific gravity. So that diuresis is genuinely reducing the specific gravity of the urine. But again, in this study, you can see it's not achieving a urine-specific gravity of 1030, which we might ideally want in a cat that's had urolithiasis. So are there other ways that we can increase water intake in these cats? Number of strategies that have been talked about: the type of water bowl, the depth of the water bowl, the position of the water bowl, type of water that's offered. Most of these we don't have any scientific information to tell us whether they work or not. A common strategy has been to offer running water or moving water to cats in the hope, at least, the idea that this may increase water intake. Cats may prefer to drink from moving water than still water. There's actually been 3 good studies that have been published on this, and none of them showed that any of these water fountains or bowls where the water is moving, none of them resulted in significantly increased water intake. There may be occasional cats that prefer this, so it may be worth trying, but on the whole, these don't increase water intake in cats. Interestingly, what has been shown to work is what's called, or been called, nutrient-enriched water. Proplan have a product called Hydrocare, which is a nutrient-enriched water. This is a water-based product, it's 98% water, but it contains glycerol, contains whey proteins, it contains some gums, some potassium chloride, and poultry digest as a flavoring. Now, these gums and some of the other constituents make this more viscous, and that may be one of the important things with this, and obviously it is a palatable product as well. And there are a couple of studies with this that I wanted to highlight to you. This particular study was a group of cats that was offered dry cat food, and they were either offered tap water to drink alone, or they were offered tap water and this nutrient-enriched water. And they were monitored for nearly 2 months. And what this study showed was when they looked at 30 days and when they looked at 56 days, there was a significant increase in the total daily water intake in the cats that were offered the nutrient water alongside tap water. As you can see, 30 days, there was an 85% on average increase in total water intake. After 56 days, on average, 74% increase in total water intake. And that was reflected in reduced urine-specific gravity. Specific gravity was significantly lower in the cats that were offered the nutrient-enriched water. Show you one other study that also looked at this nutrient-enriched water. Cats were again offered dry cat food and either tap water alone, which was constantly available for all of the cats, or this nutrient water in one group of cats that was offered to them on a twice-daily basis. These cats were monitored for 10 days, and again, significant increase in water intake, total water intake in the cats for the nutrient water, and significant reduction in the urine-specific gravity. And you can see here in this particular study, the urine-specific gravity went down below 1030 in these cats. Now, the fact that this is viscous water and the fact that it is palatable probably are two of the most important factors in increasing the water intake and getting this further reduction in urine-specific gravity. But if we're looking at evidence-based medicine, and if we have cats that have had an episode of urolithiasis, and we want to try and reduce the risk of those cats having a recurrent episode, then feeding a therapeutic urinary diet is the single most important thing we can do. A diet like Proplan UR, where we know the urine is going to be undersaturated for struvite and it will be in the low metastable range for calcium oxalate. That is an excellent diet for long-term maintenance and reducing the risk of recurrence, and indeed for dissolving struvite uroliths. Ideally, we want those cats to eat a wet diet rather than a dry diet, because that will increase the overall water intake and it will help to dilute the urine more. But whether those cats are eating a dry diet or a wet diet, if we want to try and further reduce urine concentration, if we want to reduce the risks further of recurrent urolithiasis developing, then using something like this nutrient-enriched water, this Purina Proplan Hydrocare product, where we can see an increased water intake in these cats, on the basis of evidence-based medicine, published data, this is the one strategy to increase water intake beyond actual water in the diet itself that we can strongly recommend, and may help to reduce the urine-specific gravity and further reduce the risk of recurrence of urolithiasis. So I hope this has been useful to you. I hope this may help in your management of cases of urolithiasis in the future. I'd like to end again by just thanking Purina for the opportunity to share with you today and to share some insights into this common problem of crystal-related disease in cats. Thank you very much.